Hi, everybody. Welcome back. Welcome to our 11 o'clock session. I'm just getting a few things straightened out here. So we're very honored and excited to have with us Bart Bailey today, who is going to be speaking to us of the title of his talk is COVID, healthcare disparities and COVID-19. And Todd Patterson is going to be our moderator for the session. I'm Todd. I am making you a co-host. So with all rights, privileges, and responsibilities, all rights, privileges, and responsibilities have been confirmed upon you in this session. I'd like to thank our moderator and our panelist, our speaker, Bart Bailey, for joining us today and for helping us out and educating us and providing a space for us to have an awesome conversation. Everybody, you don't need your Zoom basics, but I find that the speaker view is pretty helpful because it just spotlights Todd and Bart. I'm actually going to remove my spotlight. And so I pass this over to Todd to get things started. Welcome everybody to the session, and I look forward to getting into it.
All right, thank you, Ken, and good morning, everyone, and thank you for attending the Peace Conference and today's session. As we go through the session, please type any questions you have in the chat box. I'll be looking at that, and we'll certainly ask Bart as many questions as we can as time allows towards the end of the session. I'm Todd Patterson, a geography and political science adjunct instructor here at Northampton Community College, and I'm pleased to introduce Bart Bailey, who is the owner and principal consultant of Courage to Care, LLC. Courage to Care is an organization devoted to leveraging justice, diversity, equity, and inclusion to foster belonging and minimize othering. Aside from founding Courage to Care, Bart has facilitated unconscious bias and cultural competency workshops for several organizations, including the University of California, Berkeley MBA and EMBA students, Lehigh Valley Health Network's pediatric residents, Verizon, New York Presbyterian, Eyre Middle School, and Lehigh Valley Martial Arts, to name just a few. He has facilitated workshops for the Allentown Police Department in the area of unconscious bias and work with the police and community to improve relationships between the two. Bart serves on family advisory councils at 2 children's hospitals and on Lehigh Valley's Health Network's Cultural Awareness Leadership Council. He is also a member of the Greater Lehigh Valley Chamber of Commerce's African American Business Leaders Council. He chairs a scholarship committee for the Alpha Mu Nu chapter of Omega Psi Phi and is a member of the study of African American life and history. He's facilitated workshops with middle school students in the area of understanding self, compassion, and empathy, and recently served as a consultant with Cook Ross, the premier organization in the space of diversity and inclusion. In the wake of COVID-19, this morning, Bart is going to talk us through about building bridges and from a healthcare standpoint. So thank you, Bart, for joining us today.
Thank you, Todd. It's my honor and privilege. And actually, Ken, if you can make me co-host as well, I'm gonna share a few screens and I'll go back and forth between sharing and dropping that as well. But I wanna share a few slides with you and ask people to actually engage in a dialogue, because this is not gonna be me talking for an hour. And so I wanna start with sharing some data from some of the sessions that I've done with other organizations, and then we'll kind of chat about it a little bit. Let me make sure I get this right. So you should be able to see, it talks about objectives. We're not really going to go into all of that, but you got somebody that wants to be admitted. So one of the things that I think is important, I'll just cut to this one screen, and often what I ask people to do, and I'm really going to talk about the 4 agreements as we have our conversation together. Be mindful of the 4 agreements. Be honorable with your words. Speak your truth without blame or judgment. Noted is your truth with the lowercase t, right? We think we all know our truth, that it's the absolute truth, but it's, as you travel around the globe, you understand that there are different truths. Be aware of what your gut is saying and then bring your best self into this discussion. I want to start here with a little bit of stuff and then we'll move forward from there. But I would encourage folks to just kind of check out a special that Diane Sawyer did about our new reality. It was done on May 24th in 2020. It really talks about the disparities. And then Athena Jones had an article on April 6th, and she was talking about, Michigan, 14% of that population is African-American, but at that point in time, 40% of the COVID-19 deaths. And then again, Chicago, 30% African-American, but 72% of the COVID-19 deaths. And then Louisiana, African-American population was 32%, but then 70% of the deaths were COVID or African-American with COVID-19. So just kind of look at that and you see that there's something a little odd about those numbers. And so let's talk about a little bit, healthcare disparities, the disproportionate difference in health between groups of people, right? By itself, despair does not address the chain of events that produce it, and then health inequities, difference in population health status, mortality rates that are just systemic, right? Patterned, unfair, unjust, and actionable, as opposed to random or caused by those who become ill. There's some factors that really show up, right? Conditions under which people are born, grow, live, work, and age. And then equity, a just, fair distribution of societal resources and societal opportunities needed to achieve well-being. And we know that there's some gaps. And I'm going to share with you a little bit of how this has showed up. It's just not by happenstance that we're in this state. And here's some factors, right? Access to medical care, access to nutrition. We know that some people live in food deserts, right? Access to clean water. Many of us know what was going on in around the country with lead poisoning, right? Early childhood, social and physical, environmental factors, and just a whole host of things that show up that hinder our ability to provide care in a way that is competent, right? So I want to share with y'all that I've done a few things, and I'll just put this up. And this is where I want to engage with some folks and have a dialogue. But I've had these conversations around some social determinants. And what I've asked people in the past, as you look at our entire country, what stage do you believe we are in as it relates to COVID-19, right? And I'll circle back to this whole thing around disparities. But I ask people, what stage do you think we're in as it relates to COVID-19? And this is just it's a bell-shaped kind of curve. And many people said chaos, as you can see. This represents about 200 people that were participating in 4 different sessions. So it's about 200 people that just selected chaos. So if you're familiar with how to use Zoom, if you would have selected chaos as well, can you raise your hand? And I want to ask you why you would have selected chaos, right? And then I'll circle back to the disparities. So and to raise your hand, you toggle over your name, you open the participant list, toggle over your name, go to the right. It gives you option for more, and then you can kind of raise your hand. It'll be a little feature there. If you would have selected chaos as well. All right, Sam, can you unmute?
Yeah, yes. Hello.
So you think you would have selected chaos as well in terms of what stage we're in as a country, right?
Yeah.
And why do you think you would have done that?
Basically on the fact that pretty much everyone refuses to all believe in one thing. There's big chunks of the country that believe, oh, this pandemic is nothing. Everything's fine. And there are other parts of the country that actually think and know that we're not fine.
So I don't know what you do for a living. I don't know if you work in the healthcare field or not, but as you think about that, and I showed you just for you personally, and you see that there's not a clear plan and we're kind of all over the map. How does that make you feel? Sam, if you don't mind, unmute.
Frankly, terrified.
Got it. So think about your situation. I don't know your identity markers. I don't know how you identify yourself. But what I showed you in the beginning, right? So that sense of terror, being terrified. Imagine that you live in different pockets of the community, and you're African American or Native American or Hispanic / Latinx, and you know that there's a potential for this to impact you even greater based on a few factors. How might you think that shows up for other folks? That sense of fear.
Probably even more than me.
Yeah. And it's not a good or bad thing. It's just we're not even conscious of it, because when I'm in my own fear, I'm not thinking about nobody else. I get it, right? And just think about the layers of stuff that shows up. So let me ask you this, Sam, just for you, right? That sense of fear. If you made a concrete request to the rest of us in the United States, or the rest of us in Lehigh Valley, right? What would be that one concrete request for us to deal with COVID-19? What would be your one request?
To calm down, to think, to try and listen to the people who know what they're doing.
Got it. So last question, then I'll let you go back to mute. What do you think it is that makes it so challenging for us to trust the science?
Sorry, I'm not sure I understand.
What do you think it makes? So we're all over the map, right? We don't have one strategic plan to deal with this thing, right? And for many of us, some of us are like, yep, I'll wear my mask, I got my mask. Some of us are like, no, I'm not. What do you think the challenge is for us to get aligned on one direction?
I think the challenge is that there are a lot of people who are in different positions of power, but all of them are saying different things. It creates an air of confusion. We don't know which scientific fact we're supposed to believe in.
Got it. So I'm gonna come back to that. I have a thought about Destiny. I saw your hand. Don't you disappeared on me. Destiny, if you don't mind unmuting. I saw you.
I was pretty much just going to say the same thing, that pretty much a lot of people in power are saying different things, so it makes it hard to listen to, like, who are we supposed to listen to here?
Got it. So Destiny, if I don't mind asking, right? So we're talking about COVID-19 and the disparities and how it's impacting different communities. But what is it for you, Destiny, when you finally connect with someone? What is that one thing that allows for deeper connection? What is that one thing, Destiny?
Can you repeat the question again? I'm sorry.
So when you meet somebody, right?
Yeah.
And it's just it's just a good thing. You feel good being around another human being. What is that one thing that allows for that to happen?
Like some sort of connection that you guys make.
Yep. And what do you think it is? What's underneath that?
It could be like physical connection, or even just like I don't know.
You got it. But so what I'll say with I don't want to put any words in your mouth, but for me it's that sense of belonging.
Yeah.
Right? That sense of appreciating each other's humanity.
Yeah.
All right, so I want to keep going. Thank you. I'm going to keep going and share a few things with everybody. So as I move through these slides, right, and I want to share some data, right? So I'm talking about healthcare disparities, and many of us don't understand how we even got here. So Jim Downs has a book about Sick from Freedom. He's talking about the 1860s when 1860, 1863, 1864, when you say slavery is over. Right. And so they had a medical division, the Freedmen's Bureau, to establish separate but allegedly equal health care for folks that were newly freed. But mind you, these folks didn't have a place to go. People were feeling a certain kind of way about them being freed. And there were some folks that, you know, providing healthcare might breed dependency versus providing care. Prior to them being free, trust me, they were cared for. Even Ohio, one of Ohio congressmen stated that the African Americans were there was something wrong with them, that they would soon be extinct because they are now free. And so, mind you, being free, not having a place to live, not having food, what I'll share with you when you understand the data, 4 million African Americans were in this country at that point in time. A quarter of them died, 1 million, right? And what I'll share with you, our laws support our collective values. This congressman in the House said that folks were inferior and they will soon be extinct. I want to invite you, really want to invite you to listen to it. I don't care, whatever your thing is around the 1619 Project, listen to the podcast, episode 4, that talks about healthcare. Truman made at the State of the Union said he wanted universal healthcare, right? But then the AMA, American Medical Association, were like, nah, that's gonna hit my pocket. So what ended up happening, Dr. Montague Cobb later approached it from a Medicare perspective, that our elders need care. So that's the National Medical Association, which was predominantly for African American doctors. We need to understand our history, folks. So think about this. We have a group of people who are freed, not provided care, and no place to go. And we think that because now it's from 1860 or 1864, and we're now in 2020, and things are different, but I'll share with you in many ways, these hot spots and zones where people live show up in so many ways, right? So I'll just share that with you. One other thing, I want to switch gears, and if anybody, I know that there was some conversation around some folks who are pursuing their nursing degrees at NCC. So I want to share some things with you that I think all of us should be aware of, and I hope that you understand where we're going, and I'm going to connect it back to healthcare disparities. There's some studies around ACEs, right? And so ACEs are adverse childhood experiences. And again, this connects directly back to the disparities. We need to know or be aware of how ACEs may show up. Is there physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, domestic violence, parental substance abuse, household mental illness, parental separation and divorce, suicide or death, and then crime and imprisonment. Now, understand that these are things that people may grow up under, and we need to understand that they show up in our adult lives as well. Many of us are a product of ACEs, and we're not even close to understanding the impact that ACEs had on us, all of us. I don't care what your ethnicity or race is. And some of the things, how it shows up is risky behavior, chronic health issues, whether it's smoking or whatever, low life potential, and early death. ACEs have significant impact. And again, it links back to our healthcare disparities, because ACEs can be resolved by support systems and structures. But if I live in an area that has food deserts, it can have significant impact. Yes, Sonia, absolutely. Matter of fact, go ahead and unmute if you want, because I could talk about that too, but I'd rather bring another voice into it. Have significant impact on education systems. So Sonia, if you unmute.
Yes, those are my daughters playing in the background. I just want to say that I know there's my daughter's saying hello. I don't remember the particulars, but I read an article that addressed the fact that these traumatic childhood experiences can have an implication on education in K through 12 and even beyond. If you just think, for example, how hard is it for a child to pay attention and learn in school when they may be abused at home?
And trust me, abuse as a whole thing. It's not like it's not the whole somebody really getting whipped or anything, but abuse shows up in many different ways. And many of us don't understand what trauma is, right? Is it acute? Is it chronic? Is it complex? Acute, it happened one time. Chronic, several times the same thing. Complex, I'm dealing with so many different layers of trauma, and all of us are dealing with the trauma of COVID-19 and the trauma of racism, all of us. And we're not even close to understand how that shows up in our physical body, not even close. And so one of the things, if you're familiar or if you get some exposure to the Institute for Patient and Family Experience, Family-Centered Care, here are some of the things that they're trying to do to address the disparities. This is one way, right? Really developing trust with the community. So healthcare institutions understand what it means to develop trust. Reciprocal relationships. It's not you come to me and I just serve your ailments. I treat you as a being, a human being, and we connect on our humanity. And then we're open and honest. If I walk in and I'm triggered about the way that from the check-in, the way somebody addressed me, I'm going to be honest about that in a way that I can communicate with you that I'm not putting you on the defense, but we're talking to each other as human beings. And other people see my humanity. Transparency about care. I feel comfortable sharing with you what's really going on with me, right? So someone were to take my blood pressure now, it probably would be high. But if you purely think it's just because of whatever, yeah, I'm dealing with COVID-19. I'm dealing with, the aftermath, what's everything that's going on with our race relations. So my blood pressure is a little high, right? A little high. And so just giving some pills may not really deal with the whole deal. And then cultural competency, right? Can you, if you know, just look at the Valley, that we have people who English is our second language. Do we give information in different languages? Do we leverage interpretive services, right? And not just bring someone in and say, hey, can you just talk to this person, or talking to a child to relay that message to their parent? Culturally competent, and knowing that there are differences that show up, right? We've heard stories of women dehydrating because of their ethnicity and their culture. They don't drink ice water right now because it's a hot season, so they drink room temperature water. And if you give them ice water, they're not going to drink it. Literally dehydrating because you're giving them something that they do not want. And so we need to be culturally competent to service our community, right? And knowing what's happening. And then co-learning. We have doctors, nurses, and practitioners that know a lot, but do we know the culture? And so that when we're dealing with an issue, we're co-learning and treating it, right? And so getting into the healthcare disparities to understand what is the environment that this person is living in. And then really partnering. If we're trying to deal with someone's health issues, not only partnering with the patient, but the community organizations that uplift and hold the community together, partnership, so that we can deal with these issues. Team-based care, like I said, from the reception, medical assistants, nurses, physicians, family physicians, administrators, and then if there's social workers that are needed, that's how you deal with the SDOHs, social determinants of health. That's how you deal with it. And we want to make sure that we're conscious about those things that impact quality care. So I want to pause for a second and actually stop sharing the screen. And if there is anyone that is pursuing a career in nursing or health, what's triggered for you so far? What's triggered for you so far from what I shared with you? And Ken told me that we had a couple folks that were pursuing nursing. So I want to pause and just talk. You can kind of raise your hand, unmute, or anybody in healthcare. What's showing up for you so far based on what I shared with you? You can just unmute or raise your hand. Go ahead, Kelly.
I work in long-term care. Can you hear me?
Yes.
Okay, I work in long-term care, and the first thing that came to mind is the interpreter. Because they're elderly, they kind of get overlooked, and they don't make a huge effort to get interpreters when they do assessments here. And a lot of times that triggers behaviors because they're already confused and they don't bother to try to really bring anyone in. So it just makes things worse.
Yeah, and I without even talking about your institution, and we know that adult and senior living were hit hard, right? So just imagine you're dealing with COVID-19, you need an interpreter, we're not going to use the interpreter. Kelly, you know, how might that impact the care, the quality of care, if you're not using an interpreter?
Oh, well, yeah, I mean, I work with dementia, so that alone, you know, there are certain things, needs, they're already come in confused, combative, and then, you know, because of lack of staffing that even is able to interpret, there's no real effort. They're kind of forgotten just because they're elderly, dementia. So when they don't have that interpreter, it just makes, you know, enhances their behaviors.
Thank you for sharing that. Anybody else? What's shown up for you so far? We have 49, 50 people on here. As I talk about the disparities, what comes to the top of mind? And let's bring it a little bit closer when you're thinking about, go ahead, Marilyn. I think you're unmuted. And then I'll come to you next, Abby.
I love what you're saying, and I work in mental health nursing. And one of the concerns that I have is how much I need to shut my mouth and just listen to what people are trying to say to me, because I somehow think I understand something when really I have no idea until they really sit and tell me, you know, what's going on. And I think that's been probably the best lesson in all of this, is just being humble enough to say, I don't know what you need. So will you please tell me? And then I will do my best to be helpful to you in this. And I love your point about working with community agencies. I was a parish nurse for 15 years in this, and I was absolutely floored by the number of loving people who want to help, okay, but they've not been asked in this. And so, you know, it sometimes took over 100 phone calls to get somebody connected with the people that could help them in this. So I very much appreciate what you're saying. Thank you.
Oh, thank you. And here in the Valley, there's so many agencies that want to help, right? But do we know to pick up the phone and call, right? To close those gaps so that, you know, so that we deal with some of these healthcare disparities, right?
It takes a lot of courage to call and keep asking. And particularly because my Spanish was so terrible that, you know, having to get somebody to speak in the dialect perhaps that I needed in all of it, it was so humbling. And I think it was really such good education to just stop and say, just keep looking, just keep trying, just keep listening. And I really value the people who taught me, you know, some of these skills. So thank you.
Awesome. And what I'll share, and I'm gonna come to you next, Abby, I connect all that to empathy. Right. And many of us think that, oh, I work in healthcare, that empathy is easy. I'm going to tell you right now, empathy is not easy. Right. Empathy has 4 components: appreciating someone else's perspective, suspending your judgment, recognizing emotion in someone, and communicating your recognition of that emotion. The first 2 are very challenging. Appreciating someone's perspective, as divisive as we are right now as a country, we don't appreciate each other's perspective. And then number 2, suspending our judgment when many of us are judgmental people, that's a difficult one as well, right? So empathy requires us to do some real work, and it's challenging at best. So Abby, if you can unmute, share with us what's shown up for you so far.
My thought was similar to Kelly's. I work in home health care, and just from COVID and being short-staffed, there's so many cases of people that speak Spanish or different languages, and we don't have enough workers that speak those languages. And so, because when you're doing home health care, it's just you and that patient. There's nobody else you could really ask for help. And so because of the shortage of workers, it's been leaving people without care. Nobody's coming in to get them out of bed in the morning, and different things like that. So it really is a problem.
So and I got to ask this question as someone who's working in that field, right? And I share in the beginning how the numbers show up, and I'm sure I could pull up another state, show up differently by, you know, the population, percentage of the population. So African Americans this, or Hispanic and Latino or this, but a greater number of the death, right? So Abby, as someone who works in that profession, and you hear some of those stats, you see some of those stats, you work around some of those stats, how does that make you feel? I'm talking to you, Abby.
Sorry, I know I couldn't get my unmute. Well, it makes me feel like terrible. Like there's only so much, you know, one person can do. There's only so much I can do to help, but
Yeah.
but it's just, I don't know. It's terrible to think like, oh, if that was your grandmother, you know, laying in bed or and no one, there wasn't enough staff for her to come get her. Like that'd be terrible.
So let me ask you the same question I asked before. So if you're a healthcare professional, you had one request to the rest of us in the Valley, what would that one request be to really deal with this issue?
I honestly don't even know. I don't know.
So I'm asking that question for a reason, and I'll share why in a second. So I want so I see a few other folks working in the similar industry. I want you to type in chat. Think about it. What would be the one request of some of you in the healthcare industry to deal with the disparities that are showing up in the healthcare industry here in the Valley? What would be the one concrete request to close these disparities, to close the gap, to appreciate each other's humanity? What would be that one concrete request you would make of us? Sonia, go ahead.
Did you want me to address that or go on to my?
No, go ahead. Your thing.
I'm not in healthcare. So I teach at Northanger Community College and I teach microbiology. So the majority of my students are going into nursing primarily, but healthcare in general. And in regard to racial disparities, I know that COVID-19 helped shine a light on them. So they were already there. And I know there's been some talk about nursing homes, but it goes from childbirth all the way up to nursing homes. There was a study recently that showed that Black infants under the care of white doctors die at a higher rate than white infants under the care of white doctors. And the reverse was not true. So Black and white infants under the care of a Black doctor had the same infant mortality rate. And in regard to my students and those going into healthcare, I hope that they will know this and believe it, right? So these disparities are there and they're well documented. And I'll just share that I'm in touch with some of my former students, and I had shared this same article on Facebook. And one of my former students who is wanting to go into nursing commented in disbelief. And the mindset was, surely there are other factors, the lifestyle, other, basically wanting to blame the victim, if you will. And I know that she wasn't coming from a place of animosity, but truly disbelief. She couldn't believe that a doctor could, or nurse or what have you, could walk through a hospital and actually treat two different patients differently because of the color of their skin. And I think this disbelief that people have, maybe from a good place in their heart, sure, maybe you would never do that, but that doesn't mean people aren't doing it. And it's probably not conscious, but unconsciously, subconsciously, because of bias or what have you, this is happening from childbirth until hospice, right, until death in nursing homes and whatnot. And I think it's important for people in healthcare or aspiring to be in healthcare to know that this is the reality, these healthcare disparities, and to see them for what they are, that root of white supremacy and institutionalized racism, and not to just say, well, the family probably didn't eat healthily enough, the family probably didn't, value healthcare, those sorts of things, where you put the onus on the patient rather than on the system.
Oh, absolutely. And so what I'll share with you, so I started from the beginning. So think about what I said. When folks were freed, the treatment started there, right? And there were bodies literally in streets. And then the belief that you're just, inferior, right? That kind of thing, because there were cures for some of those things. It was smallpox and some other things that were going on. And what I'll share with you, there's a 2005 study with students now that believe that Malik, I saw your hand go up, so I'm gonna ask you. 2005 study with people who are in healthcare pursuing that, doctors that again had some misconception around pain tolerance, right? That African Americans, Black folks have a higher pain tolerance. Like, you know, again, this whole notion around treating people as other versus really connecting on our humanity. Malik, can you unmute, please?
Yes, hello. So my thought on this, the racial disparity, is that we need more seats at the table for different cultures and understanding people, basically. Like, especially with the fact that you raised with, because I am African American, and I remember that because I was reading my textbook and it was talking about how doctors perceive like African Americans having a higher pain tolerance, which is mind-boggling to me because we are all humans at the end of the day. So my suggestion would be that we have more seats at the table and more inclusivity in healthcare with the cultures and understand where people are coming from, and just not put up a door or a barrier to say, oh, your voice is not important. You don't know what you're talking about. In fact, they do, because this is their culture. You know what I'm saying? Just having a more open, welcoming arms and start having those conversations. You know what I'm saying? So that's my thought on it so far. And I'm a nursing student at Northampton Community College.
Okay. Thank you for jumping into the profession. Good stuff. All right, so I want to go back to sharing a little bit because I do want to leave more time for questions or dialogue. So let me make sure I do this properly. I do like the Brady Bunch view better than me talking. I'll just let you know that. So again, we talk about team-based care to deal with the social determinants, but however, we have to be culturally competent. The receptionists and medical assistants must be culturally competent. Nurses, physicians, assistants, and health educator have to be more culturally competent. Go back and give some of the data and study that I shared with you. You know, there's Montague Cobb is the guy who really stepped into really making sure that we had Medicare and Medicaid for our senior citizens. Again, that was during Truman, and folks were against that. Family physicians really have to treat the whole person and not the symptom. There's work that needs to be done, and we have more than capable of doing this good work. So I actually don't have a whole lot of slides and left. What I do want to, and I actually intentionally wanted to put this up because we talk about a bunch of stuff, right? We talk about the rates, we talk about what's going on. And so I do have a question around hope. You know, what are you hopeful about? And I'm going to share a few things with you that I'm aware of. What are you hopeful about in terms of the health industry as a whole and how we can choose to really connect deeper? And yes, Michael, I'll come back to those 4 components around empathy. I'll share those again. So, we talked about the gap, right? And I want some other folks to think about the community organizations we have in the Valley. You have 2, hospitals here. You have a couple other institutions here. You got all these colleges here in the area. What can we do to really appreciate each other's humanity and care for one another in a way that's more empathetic? And let me repeat what empathy is. Empathy, the 4 components are appreciating someone's perspective, suspending your judgment, recognizing the emotion in someone, and communicating your recognition of that emotion. So those are the 4 components, and those come from actually a nursing scholar. Her name is Teresa Wiseman. And so Teresa Wiseman had those 4 components and talked about why empathy is important. I am hopeful that these types of conversations are happening and more widespread. Yeah. And thank you, Sonia. Anybody else? What are you hopeful for? And you can put it in chat too. I expect to be great to get 50 responses. What are you hopeful for to close determinants? What are you hopeful for? So I'll share with you right now while we're waiting for some folks to either raise their hand or unmute that there's a healthcare institution in New York. They just got $50 million donated to an organization to deal with these healthcare disparities. I also know of other large institutions around our country that are connecting with the community and not just talking about the gaps, but actually addressing the gaps. Food insecurities, food deserts, making sure it's translated in the proper language so people can understand it and communicate what's happening with care. Really leveraging interpretive services in a way and not asking a child to interpret it, getting the interpretive service to make sure that we're communicating with people effectively. Healing of the fear of discussing. So Marilyn, can you unmute, please, if you don't mind?
Yes.
Yeah, so share with me the fear. That's a big one, the fear.
I just find that so many people are worried that they're being blamed. Okay. Oh, well, I've been working my whole life and now you're telling me I wasn't doing the right thing, rather than having an open heart to, okay, before I didn't know, and I don't have to be afraid to admit that. I can admit I didn't know, I did the best I could with the light I have, but now I need to have different light. Yeah. Now I need to come on. And I find so many people that are so angry are just tremendously afraid of changing their attitude. Yeah.
Oh, that's significant. Thank you for bringing that into this space, because many of us get in that state of fear, which brings up defensiveness, right? Oh, that's not me, right? When I'm gonna tell you right now, there are a number of things that I have done that that is othering somebody, right? As a 52-year-old African-American male, I've done things to other people, and we all have. Not intentionally, not overt, it was just part of my conditioning, right? And upbringing, and we all have. Thank you.
I think we can have a degree of forgiveness for each other, rather than like giving each other some grace, that we're not perfect, and that's okay.
And the other part of that is we have to do that for ourselves. Right. Compassion is not always an external thing. Can I cut myself some slack and offer some compassion for myself as well, right? Because it's not about blame, shame, or guilt. It's about ownership. Yes, I did do that thing, but I'm not doing it anymore.
And the reality is I'll probably do it again, okay? And I'll need to go back, and I'll need to get help again. So thank you so much.
There you go. Yeah. Thank you. Tom, can you unmute, please?
Yes, thank you. I just wanted to follow up actually on the comments that were just made. I grew up in Upper Bucks County, and I went to a rural high school. Graduated from Lehigh University, then went on to get my master's at Temple. About half the people that went to the high school I went to basically stayed in the community. And, basically I have a differing view of the world than most of them. And kind of the point I wanted to kind of just flesh out a little bit more was the empathy issue. I've always tried to be a person that kind of got along with everyone, and in the past 10 years or so, that has really changed significantly. I always was one of those persons who, truly believed in the First Amendment. Everybody gets their say. And I did that with my Facebook feed. And, those folks that I spoke about who had differing views from mine had basically started invading my Facebook feed with a bunch of stuff that me nor the other, 90% of my Facebook friends wanted to engage in or even, consider. So I ended up recently, knocking off a bunch of people off my Facebook account and unfriended a bunch of folks. The encouraging thing was that it was only a handful of people. And, kind of the learning for me was, out of like 300 or 400 people, it was literally a handful of people making all the noise. So I've eliminated those people. And and the empathy thing is I've lost empathy for that group of people that I went to high school with. And it's kind of sad. But anyway, sorry to go on, but I just wanted to kind of flesh that out because there's a lot of you know, a lot of it is, you know, personal relationships that I've lost. Literally, one of the people I unfriended it is my wife's business partner's husband, who was not a high school. So,
right.
you know, I mean, they have a partnership, and now there will be no more, you know, holiday dinners or anything of that sort. So,
yeah, and so what I want to offer, Tom, is so when you heard me ask about a concrete request, that's actually leveraging something called nonviolent communication. Now, that tool itself has some challenges, but it is a tool that you can use to actually appreciate each other's perspective. It's founded on empathy. Now, it has its challenges. I'm gonna tell you that right now. But if you can have a conversation around what are you observing, what are you feeling, how does that manifest in your physical body? Is there a need being met right now? And I'll share with you the divisiveness that's in our country. Lots of that need is based on fear, is based on the amygdala being triggered, that fight, flight, or freeze, and us trying to fulfill some need. And then what's the concrete request, right? If we can work through that in a way that's healthy, we can potentially have a conversation with another human being. However, the foundation of that thing working well is based on empathy and honesty, right? So that's the challenge with it. When folks are not willing to be really empathetic and honest, then it presents some significant challenges. But thank you. Go ahead, Ken. You're muted.
Okay, I'm unmuted. This is really amazing. I don't work in the field of healthcare. I work in the field of philosophy. But I do actually have one of the courses that's required for nurses is ethics, and so we teach that course. And it seems to me that would be a place where we'd really delve into these kinds of things. So, one question I have for you is, you know, what you would love to see the ethics teachers presenting to our nursing students. But I know it's a lot, but another angle that I would love to hear you talk on is something that I talk about a lot in my classes, is that we live in a society of interlocking institutions. And when you have a disparity in one institution, you'll have either that will not affect the other institutions or it will. And when you have wealth disparities, and we have extreme racial wealth disparities, there was just a study that came out of Boston that the median wealth of a white family in Boston is almost $250,000, and the median wealth of a Black family in Boston is $8. Like not $8,000, not $80, $8. And so when you have that kind of extreme race-based racial wealth disparities, you're going to have extreme disparities in every other one of the systems in the society, including healthcare and including COVID. So I was wondering if you could speak to the ways in which like you've shed a lot of light on what happens once somebody gets into the healthcare system and the kind of disparities in treatment that exist. But there's also the question of who's actually entering the healthcare system. And so I was wondering if you could talk about the ways in which racial wealth disparity leads to healthcare disparities, specifically COVID-19 disparities.
So you had two questions. The first one was about the ethics, and so I'll do them in the reverse.
Okay.
So when you think about the question around wealth, I will connect that right to access, right? So if you look at some of these cases in terms of areas where we saw the disparities really showing up in ways that were disproportionate, right? Many of people of color were, either transit operators or essential workers who were putting themselves in harm's way, but we're not on the high end of socioeconomics, right? But they're on the lower end of providing services for many of us. And then beyond that, if you live someplace, and this is what I was saying before, where you don't have the support structure, access to healthcare, access to food and whatnot. So I'm in a situation or a system where, my resources are limited. because of economic reasons. That's where you saw an increase in harm. And again, when we look at certain, senior facilities, there are some where they got right at to the PPEs, they had access, where some were a little bit slower to get those things in order and lined up, right? So again, it comes back down to the social economic parts of those pieces, right? And we know, right? When I mentioned the ACEs, right? ACEs are linked to our ability to get support. Every last one of us, I don't care what your ethnic background is, you have some form of ACEs, right? Whether it's 1 score, 2 scores, 4 or 5, but many of us that have multiple scores, it's about the social support systems. And again, if I live in certain communities, I can get the mental health that I need. I can get the structures that I need to deal with those things depending on the communities I live in. Many of us know that you can boil down life expectancy to zip codes. But life expectancy to zip codes, and that's purely based on economics. What do I have access to or not? Where I live at, there are 3 grocery stores. If I really wanted to walk to them, I can walk to 2, right? And so it's unreal when I know other places, they don't have a grocery store nowhere close, right? They have a corner, little something to get some stuff, and it's really not some good food, right? So again, it's access and support systems that connect to the social economic means. Now, in terms of ethics, I really would, especially if it's folks in healthcare, to have them really understand when we talk about ethics, what actually happened when it relates to healthcare and when folks were freed. Really talk about that in ethics. Was it ethical to not provide care? If we're about cause no harm, if the industry is about cause no harm, but yet we had 4 million people, just go ahead going out there and figure it out, right? You don't have food source, you don't have a place to stay, just, figure it out. And they actually went into places that were unhealthy because they needed some kind of shelter over their heads. Do the work and read it. And then go from there and understand Truman, who said, hey, we want some health care for folks. And what was said about him, that it was socialist and communist. And that time, to call him a communist, forget about it. It was done. So we're one of the leading, thriving community, but we can't give care to everybody. Basic care. I mean, if we're talking about human compassion, basic care should be part of the deal, right? I would hope. But at least we got it for the senior citizens, and we got it for the senior citizens through Montague Cobb, Dr. Montague Cobb. Make sure folks know. Teach them that stuff. Right? And then teach them a little bit about, Rebecca Crumpler, one of the first Black women doctors. I was talking to a doctor who's in the field that did not know who she was. Many of us don't know who she is. Rebecca Crumpler, right? She went down into the community. She went to the Freedmen's Bureau and into those hospitals to make sure that people knew what care was, and actually wrote 2 books. Because there was a notion around there about African Americans, there's something wrong with us. She wrote books around, these are the things you need to do to care for your family, because you're not getting access, right? You look at Philly, you got the Black doctors that are testing people for COVID. Sometimes folks just got to take over and do what they got to do to care for their own communities because there's a gap. We need to be honest about it. If we're going to close these gaps, appreciate each other's humanity. Because I donate blood, I got that universal O. Nobody's asking what race I was at. Because when you need that blood, you need it. All right. Any other question? I'm not going to extend. We can let folks go early. I'll do that. But I'm done with the deck, really. Yeah.
Hey, Bart, I do have one kind of question that might help all of us. I think you've kind of talked a little bit about it as you've talked over the last hour, but what can we as the NCC community, the students, the faculty, administration do to support the issue that you've addressed here today?
Yeah, so I love that question. And So I'll answer it with a number of things, right? So I heard Tom in the beginning, and you have no idea how much I heard Tom. You have no idea. So what many of you may or may not know, I'm from Pennsylvania. You know, I may have moved back, you know, not too long ago, but I'm born in Pennsylvania. And what I also know is 95% of us who are born in Pennsylvania die in Pennsylvania. And what that means is you have communities that have lived in places for generations. I guarantee you somebody on here can talk about their 8th, 9th, or 10th generation living here in Pennsylvania. And the beautiful thing about that is you have community and culture and real deep roots to the community, but we also other people. When I moved to my little area of, you know, in the valley, somebody said, you know, they asked me where I moved from. I said, well, I moved from, like, you know, such and such. And then I said I was in Jersey. Then they're like, oh, what part of Jersey? I said, oh, I was born in Pennsylvania. They were like, oh, right? The whole body language got different. We have this thing about people who aren't born here. So one, the very first thing is understand your cultural identity, honor that thing, but learn how it creates barriers. Number one, do the research, right? Why do I feel comfortable treating somebody as other? And it's not about blame, shame, or guilt. It's not. I need you to understand that it comes from a place of you wanting to protect something. But if you're about humanity, if you're really about humanity, hopefully that'll flip to compassion, right? I own that I learned this from my grandparents or whomever, and there's something wrong with that, right? I honor it, but I also want to connect deeper with different people from different backgrounds and culture. So let me do that work. And then understand the history. That little bit that I rambled on about, you know, at the abolishment of slavery and which showed up for folks, 4 million people, 1 million died. Understand the history, understand how as a community, we allowed that to happen. Where other parts of the community, you didn't lose a quarter. Right? It just didn't happen. So understand the truth. People aren't making things up. Understand the truth. Do some homework to understand why is this okay today? Because it's been okay. It's not a new thing. Understand the history. And then be willing to unpack how you want to show up. Right? As an NCC, as a teaching institution, do you want to show up in a way that, you know, you want to help a few people? Or is it altruistic? Do you want to empower some folks? Or you really want to have curriculum that is honest, truthful, and it's about justice for the collective us, right? Is it self-interest, altruistic, or justice for the collective us? And I would hope that your curriculum, the way you treat students, the way you engage with students, the way you engage with the community, that it's about justice. And then after that, do something, right? Being educated and having all this up here and not showing up in some action, what's the point? You gotta do something.
Thank you, Bart. That was a great wrap up from the discussion. And I think those 4 points really kind of drive it home. So thank you very much. And thank you for the discussion today. And thank you again, everyone, for joining us.
Thank you.
Yes, Bart, Todd, thank you so much. and Bart, thank you so much. For participants, everybody, thank you so much. That was a really awesome session. You've given us a lot to think about. We'll be reconvening on Thursday at 5 o'clock with the president of the college to look over the various answers that people have given to this question about what the college can do to support various speakers' causes. So I invite Bart, it'd be awesome to see you there if you can make it. And I'd like to invite everybody as well to continue the conversation in the lobby or the lounge. And at 12:30, we're going to reconvene back here where we are going to have a really exciting and I think a challenging presentation on the Black Lives Matter protests that happened in Palmerton this past summer. So
Can I make a pitch for that?
Okay, sure, Saul, please go ahead.
Okay, I'm coming up next, and I'd like for all of you to stretch your legs, have some water, get some exercise, try to digest all that you learned there, and then come back and join us as we talk about the importance of protests